they have to say, am I setting my kids up for diabetes by teaching them the lifestyle that I have adopted that got me here?
We render full spectrum trauma care here in the Valley. We have 24-hour coverage in neurosurgery, orthopedics, and in general surgery. And again, it is our job, both as a physician and as a community member, to take care of our people.
A hospitalist is a board-certified physician, whether it be internal medicine or family practice, just like any other physician.
Welcome to Camden Clark's Community Health Forum. In tonight's program, we'll feature key insights into diabetes, a disease that is now at epidemic proportions in West Virginia, and how our lifestyle and diets are such a big part of the problem, especially those living with type 2 diabetes. Also, May is National Trauma Awareness Month, so we'll share some thoughts on how to keep your kids and grandchildren a bit safer as we head into summer months, and why Camden Clark is nationally recognized as a Level 3 trauma center. And we'll provide you a unique perspective into some of the most important doctors inside Camden Clark Medical Center who provide patient care 24/7. They're called the Hospitalists. First up, we talk to renowned endocrinologist Dr. Frank Schwartz, who shares with us his perspective on diabetes, the types, the management, and prevention of it, and the increase in type 2 diabetes since he began practicing here in the Mid-Ohio Valley over 25 years ago.
The big issue is there's an epidemic. If you look at the prevalence of diabetes in our country from 1950 until now, it's just an algebraic explosion. And it was pretty rare disease. Back when individuals were hunters and gatherers, farmers, hunters, they consumed what they found that day, and now everything's prepackaged, everything is fast, it's got terrible nutritional value, our physical activity is decreased, our stress levels are higher, and it's just snowballed. There are two major forms of diabetes that patients have to recognize. The one is type 1, truly insulin dependent, and that's where the cells that make the insulin, the pancreas, the beta cells, are destroyed, either by a viral infection or an autoimmune disease. And that's less than 10% of all the patients. So the majority of my patients are that because they're more difficult to control. But the majority of patients in our region who develop diabetes have type 2 diabetes. And that is really due to the American lifestyle and obesity. So type 2 diabetes is a condition where as you get heavier, that puts stress on the pancreas. And to keep the blood sugars normal, the pancreas has to work harder. So it's like having the window open with the air conditioner on. You burn more electricity. Type 2 diabetes, you stress the pancreas making insulin to try to keep up for that obesity. And eventually the pancreas begins to fail, wear out, but there is a 10 years of pre-diabetes, which most patients don't know they have it. And then there's the first 6 to 8 years of diabetes where they may not be diagnosed and they're destroying beta cells. And by the time they're often diagnosed, they're developing complications that can be prevented if they're diagnosed and controlled early.
The prevalence of obesity in West Virginia is right around 35% now. It has more than doubled over the past 15 to 20 years. We look at children, adolescents, and adult obesity. And the prevalence of children and adolescent obesity is not as high as the rates of adult obesity, but we are headed that way if we don't do something now and we don't put the lifestyle changes and the nutrition interventions in place that need to be done.
When I was in training, diabetes in children was type 1. It was fairly rare, but it was all type 1. There were no obese type 2 diabetics. Right now, 40 to 50% of the kids referred to us with new onset diabetes have obesity-induced type 2 diabetes. If you have a family history of diabetes, you're at risk. Okay, you've got the genes and you're in the environment. So any parent that has diabetes, they got to look at their kids. And they have to say, am I setting my kids up for diabetes by teaching them the lifestyle that I have adopted that got me here? And so I try to tell patients, if not for yourself, for your kids, don't set them up for it. So that's very important when you look at lifestyle and risk. Any child that's overweight needs to be checked.
So you know as a parent, if you have problems with obesity, you know that your children are at risk for that as well. So that's when you want to start early on, teaching them good habits, showing them the difference in healthy food and non-healthy food, showing them what a real portion size is. If they want seconds and thirds, use the 10-minute rule. You want the brain to catch up with the stomach and know when to stop. And those are the times that you need to teach them, is when they're little. That's when it's most important.
Anybody that's overweight is at risk. The other thing a couple years ago, there was this healthy obesity, non-inflammatory, and they were saying that physically active obese patients are healthy and protected from cardiovascular disease. And there have just been 2 studies out in the last 4 months that have said that's not true. Obesity increases your risk. There are so many interesting components of this. For example, your gut microbiome. What do the bacteria in your gut have to do with your prevalence of diabetes? We had a native gut microbiome, and it was based on the rural diet, fresh food. We ate fresh food, not prepackaged food. Grandma went to the market every day if you lived in the city, or got it out of the shelf or picked it out of the garden home. Now we have all this prepackaged. Well, what happens is now babies are exposed to antibiotics even before they're born. Babies born to C-section get a dose of antibiotic before they come out. We overtreat every ear infection, every viral infection, which don't respond to antibiotics, with antibiotics. Patients demand doctors, I have a fever, I need an antibiotic. We've completely changed the bacteria living in our gut. And it is now linked to increased risk in all of the inflammatory diseases, whether it's heart disease, obesity, autoimmune diseases like lupus or rheumatoid arthritis or MS, and both forms of diabetes. My grandmother used to say, you are what you eat. And she was right. And so even probiotics, the trouble with probiotics, we're buying billions of them. Most of them are destroyed in the stomach by the acidity of the stomach. So it's futile therapy. We need prebiotics. What are prebiotics? Those are the foodstuffs that the bacteria in our gut like to eat. We have to recognize the problem and then try to change our behaviors that we can.
Not only are the rates of obesity rising, but also the rates of morbid obesity. In order to be considered obese, it simply means that you have a BMI of over 30. So to put that into terms of what a person should weigh, your average 6-foot male that weighs over 210 pounds would be considered obese. A morbid obesity simply means your BMI is over 40. The CDC estimates that by 2018, if this trend continues, that our obesity rates will be almost 50% in West Virginia.
The other thing that is just mind-blowing is that 85% of all non-smoking induced cancers in the United States are obesity-induced. Breast cancer, endometrial cancer, liver cancer, colon cancer, those are all linked to pancreatic cancer, those are all linked to obesity. And only about 15% are due to genetics. So that's just compelling evidence that we have to start young and try to get our weight back down into a healthier level. If you get it early, before you've killed beta cells, it is reversible. Okay? And what I tell patients is they who are successful at doing that, though, have to be like the alcoholic who quits drinking. You know, Al-Anon says you get up in the morning, you look in the mirror and you say, I'm an alcoholic, I'm going to take today, and I'm not going to drink. With diabetes, you got to get up and you say, I am a working diabetic, and today I'm going to do my exercise and my diet. And you do that every day to maintain that, because if you don't, it's just so easy to slip back into other patterns.
The key to permanent weight loss, so long-term permanent weight loss, is meal planning and meal preparation. When you are getting off work late and it's 6:30 and you don't know what you're going to make for dinner, you generally stop at fast food restaurants or you take the kids out to eat. So when you do your grocery shopping at the beginning of the week, you need to meal plan. You need to plan for all 7 meals, for all your dinners for the week. You need to prep your fruits and vegetables, get them washed and bagged and ready. You need to decide what methods you're going to use to cook. So are you going to need the crock pot? You might want to prepare 3 or 4 meals on a Sunday. So if you're going to have tacos one day, you would want to make up your taco meat and put it in the refrigerator and have everything ready to go so that when you get home, it's not going to take you an hour to cook your meals. It's going to take 15 to 20 minutes.
And so if you get somebody early and you do intensive lifestyle changes, and you can actually put patients on medicine, their A1C can be normal, but their pancreas could still be stressed, trying to compensate. So if you give medicines that reduce that stress, you can actually prolong that period of remission by adding medicine. We humans evolved, right? And we were hunter-gatherers, and we were our healthiest then. And I think we have to try to maintain our weight more than anything else.
So it's really important when you're getting ready to go out and do any of these extracurricular activities that you think about your safety first. A lot of times we don't think about that because we're in a hurry. It's such a pretty day. We want to get outside and play, but you need to make sure you're having proper precautions.
I'm Louis Hare, Director of the Health and Wellness Center, and I care because I get to keep people healthy in the Mid-Ohio Valley.
From the cath lab all the way up to when I walked out after my surgery, I couldn't have got better care than I got here at Camden Clark Hospital. There's fabulous nurses on that 3rd floor. Never have it done anywhere else but right here in my hometown at Camden Clark Hospital.
Risk factors for having vascular disease: high blood pressure, diabetes, hyperlipidemia, high cholesterol, and then smoking. The first 3, some of that you can affect with your diet, some of that's the genetic deck you've been dealt by your parents. The one thing you can do is not smoke. We do these screenings every 2nd Friday of the month. It can save your life. There is no better bargain you can find in healthcare anywhere.
Larry Stevens, Director of Ambulance Service, and I care because this is my community and I enjoy going out and helping those in need.
Memorial Day is upon us this weekend, the official start of summer. More free time for the kids and outdoor activity that can include both work and fun. We've already seen, however, some recent traumatic accidents in the Mid-Ohio Valley over the past few weeks, so safety should always be a priority, whether it's working around the house, activity near or on the water, or riding an ATV or motorcycle. We talked with Chris Dellinger and Dr. Michael Roberts about the standards and level of care that Camden Clark provides in trauma situations.
So we service a 9-county area from Pleasants County and West Virginia as far as Doddridge County to Meigs County in Ohio. And so if you or your loved one happens to be in any type of accident, we are able to take care of that here for you. We're able to take care of your injuries as the leading trauma center in the Mid-Ohio Valley.
We are a level 3 accredited trauma center, both of the state as well as the American College of Surgeons, which is a unique and special distinction in that we have to requalify for that certification every 3 years. It's an arduous process in which our facility as well as our patient outcomes and our records are carefully reviewed and examined. I'm quite proud to say that we have had a stellar record at achieving that certification and maintaining it.
We do see a lot of ATVs, motor vehicle crashes. You need to make sure that they have the proper size ATV helmets on, and also to make sure that they're not riding with passengers. That is probably the number one thing that we see, is that they think they can put 2 or 3 other people on the ATV with them, and they are not equipped for passengers. There are certain ATVs that have passengers, but you have to make sure you're on one of those. Also, because it is summer, we do see a good bit of boating accidents as well. So you do need to take those extra precautions, making sure you have the proper life vest on, making sure you know how to swim. A lot of people don't know how to swim, but they still want to go boating, so they still need to have the proper life vest on.
We render full spectrum trauma care here in the Valley. We have 24-hour coverage in neurosurgery, orthopedics, and in general surgery. And again, it is our job, both as a physician and as a community member, to take care of our people in our valley. And I think we do an excellent job of that, both as a hospital and individually as surgeons and specialists here at Camden Clark.
Hospitalist as a program or as a system of practicing medicine, this approach is here to stay. This is nationwide, adopted across the country.
I'm Taya Lincecum, and I'm the Patient Access Director. I care about what I do because the things that we do in my department are typically not only to help the community, but also our internal community, so we help a lot of the clinicians be able to do their jobs.
Great healthcare and great medicine start with strong partnerships between hospitals and specialists, doctors and nurses, caregivers and patients. That's why WVU Medicine Camden Clark Medical Center is now partnering with the WVU Heart and Vascular Institute to bring you the most advanced heart and vascular care right here in Parkersburg and Eastern Ohio. To learn more, visit mywvuheart.com.
By me working here, I know what potential we have. I know what services are available. I know what this facility is capable of. I am part of this community, and they take great pride in trying to take the best care of their patients.
I'm Sean Smith. I'm the Executive Director of Professional Services. I care about working at Camden Clark Medical Center because we truly have an opportunity to make a difference in the lives of others.
If you or a family member have been admitted to the hospital in recent years, you most likely have been cared for by a hospitalist. The term hospitalist refers to physicians who care for patients staying in the hospital and work hand in hand with your family doctor to improve the overall continuum of care and eventual outcome. Hospitalists are staffed 24/7 at Camden Clark, spending their entire workday caring for patients. We talked to Drs. Annette Hamilton and Dr. Derek Bryant about their key roles as co-directors of the Hospitalist program here.
A hospitalist is a board-certified physician, whether it be internal medicine or family practice, just like any other physician. The difference between a hospitalist and everybody's primary care physician would be that we do only inpatient care. That's the primary difference. We do not do any outpatient follow-up. We leave that to everybody's primary care physician. Dr. Bryant and I lead a team of about 15 physicians. We are all board certified or board eligible. Most of us are internal medicine. There are a few family practice physicians. Our specialty is taking care of acutely ill people in the hospital. That's what we specialize in.
The hospitalists are available 24 hours a day, 365 days a year in our hospital. We use them on a daily basis. We interact with them on a daily basis, oftentimes multiple times throughout the day. We are routinely consulted by them when they have admitted a patient to render a surgical opinion and treatment, but we also routinely utilize them for their medical expertise in following our patients that we've admitted after a major surgery. They're all highly qualified and they're all specialized in their training to take care of inpatient medical care.
We see everyday things like renal failure, which is kidney failure, heart failure, pneumonia, infections, heart attacks. Those are the things that we feel comfortable with. We feel comfortable taking care of. Once we take care of them, then we send them back to their primary care physicians for follow-up care. We are in communication with their primary care physicians. They have access to all of our information. We send them emails that contain their history and physical, which is their initial visit, their discharge summaries that summarizes everything that went on in the hospital, and then any kind of consults or specialized tests. They can get those.
Every major hospital system in the country utilizes hospitalist services. Hospitalist as a program or as a system of practicing medicine, this approach is here to stay. It's not a local matter, it's not a statewide
system. This is nationwide, being adopted across the country. They're accessible, they're ready to help, and they're here for you, and they've developed a good relationship with your primary care physicians. That means that your family doctor and the hospitalist service together are going to foster that relationship to keep this system going and keep it healthy. And Camden Clark, we're committed to making sure that the system's as healthy as it possibly can be. They're available 24 hours a day for our patients. Oftentimes they serve as our eyes and ears, frequently in the middle of the night. If our patient experiences a cardiac or lung problem, they are the first ones on the scene to render an evaluation and start the workup and treatment as needed. From our standpoint, they're indispensable. They take care of our patients' general medical needs, leaving us to focus on surgical issues. I think this is particularly important in this day and age where hospitals are busy. We're asked to render a lot of consultations on many patients, and with the hospital system in place, we can tend and focus on those surgical issues while they tend to the medical ones.
Well, one thing that's nice about working with the hospitalists is they're actually on site 24 hours a day. And so from a case management perspective, if there's something that we need to know about the patient, we can call them. They're right here. They're readily available. We can go see them. They can come see us. And then if there's any questions or concerns, they can come back and talk with the patient.
These doctors know what they're doing. They see this kind of stuff all the time, and they are able to handle these different situations. But on occasion, you'll have a patient who says, you know, I really trust my primary doctor, I want their input. So they generally, we are able to communicate with the hospitalist, and they can talk with the primary doc. Like, it can be a joint effort.
The benefit of the relationship of having a hospitalist and the relationship that's there between them and the primary care physicians actually goes hand in hand. Those hospitalists actually live here in our community and are integrated within the community, as well as sit on different committees with those primary physicians in the hospital. So they are interrelated, interconnected, and have a good working relationship.
West Virginia is my home. And when I had the opportunity to take on the directorship of the hospitalist here, I really jumped at that chance because I think it's important that we continue to strive for excellence here, but at the same time we remember the things that make West Virginians different, our commitment to hard work, to our neighbors, and to our community. By far the majority of our hospitalists being members of Parkersburg, residents of Parkersburg, West Virginia. Over the years, they've been able to assemble a pretty good team of physicians that are dedicated to the Valley, live here, live amongst us, and care for our family members just as they would in their own hometown. So I think that they've done a wonderful job of building that up, and the stable cadre of physicians is critically important, not only in terms of dealing with patients who many times are admitted multiple times throughout the course of a year. They see the same faces, the same personalities.
We are here 24 hours a day. We're available for families and patients 24 hours a day. We have a close-knit working relationship with all of the subspecialists here. So if we need to get a hold of them, we have their personal phone numbers. We can get a hold of them very quickly. Order tests in the morning as well as follow up on those tests in the afternoon. We can take actions in the same day. In the past, physicians have come and rounded in the morning, then gone to their office and received phone calls throughout the day. And if something happened throughout the day, they'd have to leave their office and then go to the hospital and address those issues that were going on. Now, since we're here 24 hours a day, we can address those issues full real time. And I think that patients get better care because of that. The efficiency in care is improved, as well as decreasing people's length of stay waiting on people to follow up on all of these tests, or their physicians to follow up on all these tests. Hospitalists are involved in all kind of quality care measurement programs in the hospital. We're always looking to best practices, as well as what's the rest of the nation doing? What's the rest of our hospital systems doing? So we want to make sure that we're providing the best care in the most efficient way in real time.
Throughout tonight's program, you've seen and heard a number of employees talking about why they care about working at Camden Clark and in this community. iCare stands for the core values of this hospital and its employees, whose goal is to improve patient and family care every day. Integrity, commitment, accountability, respect, and excellence.
My name is Rennie Levitt. I am the Director of Cancer Services at Camden Clark Medical Center, and I care because there are so many patients in our valley that need our services as far as cancer services go, and it's really my passion to make sure that they not only have the proper treatment, but that they are cared for in a way that is compassionate and genuine and caring, and we really do have an excellent team of employees that provides that care, and it's just really my responsibility to make sure that happens every day, and I'm happy to say that it does.
My name is Heidi Asbury, and I'm a business manager for the primary care offices. I care about what I do because by providing high quality, convenient access to primary care, we hope to keep you and your loved ones healthy.
My name is Jennifer Anderson. My job is I work as a supervisor for guest relations. I care about what I do because I love working with the community.
My name is David Lake, and I'm a medical social worker, and I care about what I do here at Camden Clark because it gives me an opportunity to help people navigate through the healthcare system and to deal with illnesses and find correct dispositions when they're ready to leave the hospital.
Hello, my name is Stephen Hallett. I work in the material management department. I care for Camden Clark because it is a great hospital. It is a place where a person can learn, move up the ladder if they want to, and to go to school and do whatever they want to do.
My name is Christine Myers, and I am a therapist on the BHU, the Behavioral Health Unit. I care because I believe that people should always have a chance at feeling better, and when people come to the BHU, they're usually very depressed and sad. So I think people should have a chance to not be so sad.
Hi, my name is Diana Riffle, and I am a case manager. I care about what I do because I make a difference in the patient's life. I want to make sure that they have a safe and appropriate discharge plan when they're ready to go home.
My name is Brianna Esna. I'm a registered dietitian. I care about what I do here at Camden because I get to help patients make healthy lifestyle choices.
I'm Susan Abdella, and I'm the Director of Emergency Services, and I care about Camden Clark and my job because our friends and families can get the best care here in our own community.
I am June Kuhn. I'm the nurse manager of the emergency department, and I care because we're here for our community, and that's important to me.
My name is Tina Knopp. I'm a patient advocate. I care about what I do because my job is a great job. I get to help patients and their families when they have concerns or issues, or just to make their day brighter.
Thanks for watching tonight, and we hope you found this program helpful. WVU Medicine Camden Clark Medical Center is dedicated to providing the most comprehensive health care for your family, this city, this valley. We care about taking care of you, and we care about what you think. Send any questions you might have to the email on the screen. Follow us on Facebook and find out more on our website.